I want to talk about something really important because it's no surprise that America has a serious sweet tooth. And a new study, in fact, found 99% of toddlers are eating more sugar than what's recommended for a healthy adult female. In this study, toddlers ages 19 to 23 months eat more than 7 teaspoons of added sugar per day. You know, that's a recommendation for a fully formed adult female. Joining us now to discuss is Dr. Eric Ball, who is a pediatrician. And Dr. Ball, obviously, you in your practice every day are dealing with toddlers. Are you seeing a rise in sugar intake with your patients?
Yeah, this is a huge problem with my patients. It's a problem in my own house with my own kids. And I think that the biggest health problem we have in the country right now is diseases related to nutrition. So obesity, heart disease, diabetes. And it starts at this age, right? So if you have a toddler, a baby who's eating ridiculous amounts of sugar, they're going to be children who are going to eat a poor diet, who are going to be adults who have a poor diet, and that's going to lead to all these problems down the road. So if we can fix it from the beginning as children, as babies, then we could hopefully make them healthy adults.
I mean, and that's a known fact that if babies poor nutrition as a youngster and you gain extra weight that you don't want, I mean, you're struggling the rest of your life.
Right. And I find the biggest issue is processed foods. It's the foods that we're serving our kids. And it's really hard to be a parent. Nutrition-wise, it's tough to raise a kid. 2 reasons. One, kids are naturally picky, right? So most kids, especially toddlers, 2-year-olds, 3-year-olds, it's really normal. There'll be meals where they won't eat anything, and there'll be days where they won't eat anything. And that's normal, and you have to be okay with that as a parent. But it's really tough. It's really tough to make food for your kid, and then they don't touch it. And it's very tempting to give them something else, something that they'll eat, the mac and cheese, or a sweetened yogurt, or a soda or juice or things like that.
Like you said, it is important to train taste buds early on. It has a profound impact later in life and even during childhood because of childhood obesity and all of the things that come with that. But if a mom or a dad, if they really have a picky eater on their hands, of course, they're not just going to let them go days and days and days without eating. So do you have any tips, any solutions? What can they do?
Yeah, so they won't go days and days. So hunger's a good motivator. When kids are hungry, they'll eat. Your battle will be won or lost at the grocery store, right? So my kids, they don't have a job, they don't have a car, they can't go to Safeway and get food. They are going to eat what's in my house. So I try to make sure that there's only healthy things in my house. If there's foods I don't want my kids to eat, or I don't want my patients' kids to eat, then I recommend you just don't have them in your house. If all I have at home are carrots and apples, that's what they're gonna have for a snack. If I have carrots and apples and chips, they're probably gonna eat the chips. So I'd make sure I only have healthy things at home.
Right, don't leave that, don't have soda at home. There's no need for that. And I'm not saying my kids, we never had soda at home. Yes, special events, if they went out, parties, sure. They were allowed to have a soda here and there. The biggest trick I use with my kids are juices. They crave that sugar. They love their juices. So much added sugar in the typical juice. You have to water it down, and you do that. You train them. They're getting a little bit of sweetness, but much less than the full-strength juice.